there was a woman that was referred to our hospital from one of the village clinics, and it took her 13 days to get here because they had to put together transportation within the family and get her here, and she was in labor for that whole period of time.
Wow.
And the baby didn't make it because of the transportation.
The Vassar Uganda Project EMS program focuses on bringing mothers in complications of labor from the villages and village healthcare centers to the district hospital where they're able to get the care that they need. This is a multi-phase program, one including CPR, neonatal CPR training for traditional sector health professionals like traditional birth attendants and midwives, and then village leaders, community health workers, local nurses, and the physicians. Then two, training ambulance responders that will be able to respond to obstetric emergencies with the use of what's called an E-Ranger ambulance, which is a motorcycle that's modified to handle very tough terrain with little fuel, that has attached to it a large trailer that has room for a patient and an attendant, and then medical gear and a backboard strapped to the outside. Using the E-Ranger has been successful in similar programs in 12 other countries, several in sub-Saharan Africa and one in northern Uganda.
The motorcycle has benefited the health center because previously there was no means of transporting our patients, especially mothers who are like having obstructed labor, those ones who have like a PV bleeding, or we need to refer them to the main hospital. We had no means to transfer them, so we have to look for means. Either they should get some money and go with the public means, which is more costly, and some of them they can't afford them, so they always stay here. Others, their condition will worsen, that there was nothing we could do. But at least with these motorcycles, we can pick even patients from the villages, so long as they come and inform us that there's a patient to be picked, especially gynecological conditions. We pick them and we give them free treatment from here. So those ones who we can't manage them, like those ones who need Caesar, already some operative conditions, we refer them with this motorcycle to go to the hospital. That is how we are benefited from this motorcycle.
Basically, the hospital is undersupplied. The first day that I was working at the hospital, 2 babies ended up dying of dehydration. There's just not, they don't have the supplies that we have back in the States. There's, no warmer for IV fluid, no way to even get them IV fluid unless they go to the pharmacy to buy IV fluid. There's no cannulas to start IVs. No blood pressure cuffs, no scissors, no plaster. I mean, just the basic things that we look for that we have available in the States just aren't available here. So at the hospital, basically what is going on is that people are dying of just common things that could be easily fixed if there were more supplies. With the Vassar Uganda Project, you guys are really interested in helping the community, and the educational outreach that I've seen you guys do here is going to benefit the community tremendously. Also, just the supplies that you bring, the syringes, parents have to pay 2,000 shillings for a syringe for their baby before we can even treat them. So the fact that you guys have done educational outreach and have medical supplies here, I think that's amazing, and I don't see anyone else doing that here. You guys are the first people that I've seen that have come to Iganga and have given medical supplies out like this, and even done any educational outreach towards malaria prevention, tuberculosis, anything like that. So I think that what the Vassar Uganda Project is doing is going to be a great asset for this community.
We are happy to receive you.
The Vassar Uganda Project relies on the support of donors and the time and skills of volunteers. If you're interested in contributing financially, you can choose to contribute to project expenses or the individual expenses of volunteers. You can also donate medical supplies, from the most basic supplies that you'd find in a medicine cabinet to more advanced equipment needed by the hospital. The Vassar Uganda Project is always looking for volunteers, especially medical professionals, but also people who are interested in carrying out other public health programs. For more information, see www.vassarugandaproject.org.